All right, so once again, hello and welcome everyone. I'm Nuri from the Massachusetts Health Connector, and I'm joined by my colleagues, Nikki and Melissa, who will be presenting today's information. Together, we are here to share information about open enrollment for plan year 2024, whether you're considering changing health insurance plans for the upcoming year or enrolling in coverage for the first time. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started though, we just want to share some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout. Please, we ask, please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local assister. Please note that we are recording today's webinar, and following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. So without further ado, I'll pass it on to my colleague, Nikki, who will get us started.
Thanks so much, Nuri, and thank you everyone for joining us. We're so grateful that you were able to take time out of your schedules to spend time with us, just learning about the Health Connector's open enrollment and what we want you to be aware of for plan year 24. So I'm going to move us through the presentation, and very quickly, I'm just going to go through today's topics. So we will just explain what the Health Connector is for those of you who are less familiar. I will go through some timelines, deadlines. We'll focus on the new things that people should be aware of for 2024 coverage, and also give you a high-level overview of how to compare your plan options, find out if doctors or medicine is covered within a particular plan, and give you some pointers on how to save money on your coverage. As Nuri mentioned, the presentation part should last about 30 minutes, and then my colleague Melissa is going to go through some live demos for you. So she'll explain the tools that we have available and show you how you can use them to get an estimate and find out what plans are available in your area. Also, how to search for a particular doctor, search for medications, find out which plans cover these items that may be really important to you. So with that being said, I'm just going to dive right in. So some of you may be familiar with us, and some of you may not. So this presentation is really geared toward a new person who is looking for health insurance coverage, or even a current Health Connector member who may be thinking, I want to compare my options. I want to learn a little bit more about this. And so we're glad to say, we are the state's health insurance marketplace. We're here for you, Massachusetts residents, to offer individuals, families, and small employers access to health insurance coverage. So you might be, if you're new to the Health Connector, you might be thinking, okay, well, who shops here? Like, are there do a lot of people use this site? So our typical member is people who don't get health insurance through their job or another source. So let's say you're not able to get access to health insurance through your employer-sponsored plan, or a spouse or a partner's plan. Or let's say you work a couple of part-time positions, or perhaps you drive for Uber. These are all situations that people are in, and you may find out that you could qualify for help paying for coverage. Now, I will be saying health insurance a lot during today's presentation, but I also need to point out that people can buy dental insurance through the Health Connector. So please don't think that is not an option. We do have dental coverage available as well. And lastly, I'll mention this, but will not be presenting on it today, but we do offer Health Connector for Business. So essentially health insurance coverage for small employers with 50 or fewer employees. So if you're interested in learning more about Health Connector for Business, you can go to our website. You can go to mahealthconnector.org/business, or even go to Eventbrite. We hold regular sessions on Health Connector for Business, and you can learn more about that if you're interested. So with that, I will give you just a little bit of insurance speak, but it's really important context for you as you're going through the shopping process. One of the things that is really helpful about getting a health insurance plan through the Health Connector is that you can rest assured that all of the plans sold through the Health Connector, the state's marketplace, meet state and federal standards of coverage. So our plans are known as qualified health and dental plans. And the way this works is based on where you live in Massachusetts, you'll be able to choose from a variety of plans from leading insurance companies in Massachusetts, pardon me. Now, unique to coming to a marketplace is that you are able to get savings. So many people will qualify for tax credits that reduce the cost of their monthly premium. Now, these are credits that you get in advance, and I'll explain more of this later, but essentially you as a consumer just pay the lower monthly premium. Those dollars get sent directly to the carrier. Now, also unique to the Massachusetts marketplace is a program called ConnectorCare. So ConnectorCare is a great program, and all of our carriers participate in the ConnectorCare program. So people in certain income levels who meet eligibility requirements may qualify for a low or no cost health insurance coverage. These are great plans. We can't say enough about them. And in particular, this year, or excuse me, for plan year 2024, the income limit has been increased. So more people will qualify for ConnectorCare. So we're very, very excited to share that with all of you. So I want to just explain. So we are in an open enrollment period. So as of November 1st, the Health Connector launched into open enrollment. And basically what that means is during this time, so typically open enrollment runs from November 1st until January 23rd. And I like to say typically because sometimes we extend the deadline. But generally, this is the time frame you want to think about, November 1 through January 23rd. And when you're shopping, when you're looking at coverage and you're shopping for coverage, you are choosing for plans that are going to start on January 1st. So starting in the new calendar year. Now you can see there's a little buffer there, January 23rd. Now that buffer is, people may need to come in and shop during open enrollment and they miss the, January 1 deadline. So there's still an opportunity for them to enroll into coverage beginning February 1. Now, there's also something known as closed enrollment. So outside of open enrollment, people can still get into coverage. They're just going to need what's known as a qualifying life event. But you don't need to really worry about that right now. Because essentially during open enrollment, this is when someone can come in, apply for coverage. They don't need a reason. And this is also the time that an existing member gets to shop and renew their coverage for the new year. So we always recommend that people don't get discouraged and not apply if they need coverage. So even if we're outside of this open enrollment period, a lot of people may find that they have a qualifying event that lets them enroll sooner. And really important to note is when we are in open enrollment, you are shopping and enrolling in a plan that begins on January 1. But throughout the year, when you are starting either health or dental coverage through the Health Connector, they always begin on the first day of each month. Now, as you can imagine, there are all sorts of deadlines and timelines that you need to be aware of as we're going through the process. So I'm going to step through some of those that you want to be aware of. Now, there is an application for individuals and families. So if someone is under 65 years of age, this is where you want to start. This is an application, this is the landing page for our application. So whether you're an existing Health Connector member or you're someone who's newly applying, you would be accessing the application from the same location. What I want to point out is that people are now able to complete the application in English, in Spanish, as well as Portuguese. So if you want to review Health Connector information in a language other than English, from our homepage at mahealthconnector.org, in the upper right-hand corner, you can click on languages and you can translate the website. But our application is a little bit different. The application right now is only available in these 2 additional languages, Spanish and Portuguese. Now, very important for people living in Massachusetts, this is the application. This is the one application for the Health Connector, help paying for coverage, as well as Mass Health benefits. So if we have any Mass Health members who are currently, listening in on this webinar and they're thinking, okay, I think I may be in a position, Mass Health is going through a big renewal process right now. So if we have Mass Health members on today's webinar, and you may no longer qualify for Mass Health, you came to the right place, because you may be looking and you may qualify for savings coming through the state's Health Connector. Now, my colleague Melissa is going to point out a few more things about this online application a little bit later, but we want you to become familiar with the images and what these screens look like. Okay, so let's talk about existing members and new applicants, because we have a large number of people on today's webinar. So you could be in different situations. I'm imagining that everyone's in a very unique situation. So what do you need to do? So there are certain things that are the same and certain things that are different. So let's first talk about an existing Health Connector member or even an existing Mass Health member. So the very first thing you want to do is review your application. Really, we want to point out that you don't want to create a new application. If you want to log in and you're having difficulty logging in, you're not quite sure you have an account, you can always call customer service and they can assist you with gaining access to your account. But any existing member should update their application. You want to step through all the screens, report any income changes you have, any changes to the household size. There are certain life changes. Things always happen. People move. You may have gotten a new job. Maybe there's a new baby in the family. Maybe you've adopted a baby. There's lots of shifting that happens throughout the year. So you really want to make sure that you have provided us with the most accurate information, most up-to-date information, so you can get determined eligible for the savings that you qualify for. Now, if you're newly applying, you've got to start with an online application. You've got to start with this app. I very quickly said you need to start with the online application. That is the fastest way for you to find out what you qualify for. That's the fastest way for you to get a determination. And Melissa and I will both be talking about different ways that you can get help if you're someone who really doesn't feel comfortable completing an online application on your own. Now, the next step here is the same for absolutely everybody. When you get to the eligibility page, there may be proofs, there may be documents that we're asking you to share with us. And there is going to be a deadline associated with those materials. So we need everything within 90 days, and you'll see that, and we'll talk about that a little bit later as well. And then the next step is also very similar for both groups. That's the step of shopping, comparing your options, choosing what is going to be best for you, and then enrolling in that plan. So this step, super important in order to be sure your coverage begins on January 1 of 2024. You want to complete your plan selection. If you owe a premium, you need to pay that by December 23rd, and then your coverage can begin on January 1st. Now, for members, there are different communications related to renewals and open enrollment that you will be receiving. So as we're going through this renewal process, you will get official letters, notices from us. The image to the right is just a sample image that just shows what a final eligibility letter looks like. So in addition to this, there are other mailers that we send, but they are all kind of trying to give you the same information. What is it that you need to do? Let's go through this step by step. And what are the important dates that you need to do these things by? In addition, you will get links and information about different ways that you can get help as you're going through this process. You can call our customer service. You can also look for local help. So if you need assistance in a language other than English, that's going to be available for you. Now, on this slide, I mentioned when I was talking about existing members, new members, it's really, really important that you keep income and application, keep your income information and other household information up to date. So of course, we're focusing on this right now, but because it's open enrollment, but throughout the year, a member can come back in and make changes to their application. So if your employment situation changes, you have a change in household size, somebody new needs coverage and they're part of your tax household, just come on in. This updating your application helps us make sure you get the right amount of help paying for your health and dental coverage. You have a lower risk of owing money to the IRS when you file your taxes next year. So I will explain this in detail, but essentially those tax credits, that advanced premium tax credit, you, based on someone's eligibility, they're going to qualify for a particular amount. As a consumer, you have the right to say, okay, I may qualify, let's say, for example, for $500 of tax credits. Maybe I don't want to take that full tax credit because I know my income is going to go up at the end of the year. You have that ability to adjust the amount you take. And it's really, really important to know that when you're completing this application, because you can get some cost savings through state and federal dollars, you are agreeing to file and complete your taxes and also reconcile your these tax credits that you get. So sometimes people find that they get additional dollars back. Let's say you overestimated your income and it was actually lower for the calendar year. At tax time, you may get some dollars back. Sometimes the consumer actually gets to a point where they hadn't updated their income. And actually, you know what, I'm going to ask my colleague Melissa to just talk a little bit about this, because practically speaking, Melissa, I feel like you work with a lot of clients, and I feel like this is one of those areas where you're always advising people, like, you know, why it's so important to keep us updated, particularly your income, someone's income information.
Thank you so much, Nikki. Yes, so it's very important to keep your income updated because that determines your eligibility. So let's just say you're not working as many hours that you were working before. you can get a new plan that is more affordable based off of that information. So what I like to tell people is if you have any trouble going into the application and making those updates, please make sure to reach out to us. We have assisters that are available, and we have a customer service number that you can call. Please reach out to us and do so. And we're here to help you with that process. Also, keep in mind that if there's any documentation that we need, this is extremely important as well. When we do go and make those updates, sometimes the system will say that we need income verification. You have 90 days to submit that information. So please, if you have any trouble uploading that or faxing that over to us, please reach out to us. We are available to help you with that entire process.
Great. All right, so Melissa's not going to go too far because she'll have very practical advice to provide, and she's going to also help answer questions. So thanks, Melissa.
Thank you.
So let's talk a little bit about what's new about 2024 coverage. So the first thing that's really important to share, and we're very pleased to be able to share, is there is more financial help available to Massachusetts residents beginning this plan year. So I had already mentioned that the Health Connector is the only place that you can access state and federal subsidies. Remember, that is because we're the state's official health insurance marketplace. Now, the reason that there's more financial help available is because beginning in 2024, we have a pilot program that is expanding the eligibility for the ConnectorCare program. Now, the ConnectorCare program, as I mentioned, is unique to Massachusetts. The plans are subsidized, so somebody will see low copays and no deductibles. And essentially, this delivers, through this program, we're able to deliver thousands of dollars of savings to the member, compared to just shopping and buying a commercial health insurance plan without these savings. So again, how does this happen? The ConnectorCare program combines federal dollars, state dollars, and that's how we're able to offer the low monthly premiums and low point of service cost sharing. Now, don't fear, if you aren't eligible for the ConnectorCare program, you might still qualify for those federal advanced premium tax credits. Again, that will help lower your bill. And lastly, just to reinforce this and leave you, just feeling comfortable with this, when you enroll in a plan through the Health Connector, all of our plans meet state and federal standards. So you never have to worry about paying, a tax penalty or that you don't have comprehensive coverage. Now, let's dive a little bit deeper into those advanced premium tax credits. So I've already mentioned, that they lower the premium amount you pay. The IRS sends those dollars directly to the insurance company, so you just pay less. And as a consumer, you get to choose how much of what you qualify for you want to apply. Do you want to apply the entire tax credit to the monthly premium amount, or do you want to reduce that? And as I've mentioned, the ConnectorCare program, you can see you get the savings through state and federal dollars. It has low monthly premiums, low out-of-pocket costs, no deductibles, really important, no deductibles. And depending on a person's eligibility, you could be enrolled in a $0 plan or as low as $255 per month. There is a range of monthly premiums, and we'll talk about that as well. Now, also new for plan year 2024, there are more health insurance plan choices. So all the health insurance companies who participate with the Health Connector on our marketplace are offering ConnectorCare plans beginning in 2024. So in addition to Fallon Health New England, Mass General Brigham Health Plan, Tufts Health Plan, and WellSense health plans. You will also see ConnectorCare plans through Blue Cross Blue Shield of Massachusetts, Harvard Pilgrim Healthcare, and United Healthcare. Again, these changes will be in effect January 1st, but because we're open enrollment, you are now able to see these options and compare your choices. So in practical terms, what does this mean for a Massachusetts resident? For an individual, the change is going to increase the income limit for ConnectorCare from $43,440 to $72,900. And for a family of four, that means increasing the income limit from $90,000 up to $150,000. So if you have a family of four and you're making $150,000 or less, yes, there are some savings available for you here, and you can qualify for that ConnectorCare program. So what does that mean in terms of what somebody would be required to pay? Now, if you are not an existing member and you're newly applying, you can use our Get an Estimate tool, and you can see which health insurance carriers are available in your area. You also need to enter just a little bit of information about income, and you can get an estimate of what your costs may be, what the savings may be. Now, for ConnectorCare, in every plan type, let's say, there is a health insurance carrier that is in the position of being the lowest cost carrier. So, for example, for plan type 2B, someone can enroll in the lowest cost plan, and that will cost them $49. And then, as you can see, it goes up as someone's income goes up, but you can pay as low as $96, $142, $219, etc. And again, all of this is going to vary. There are a lot of individual nuances here. However, these are, you'll be able to see these types of savings if your income falls within these ranges. So on the next slide, I want to just start showing you how you can compare your options, and then you can know how you can save on Health Connector plans. So when you're shopping for health insurance, we have a number of tools that can help you compare your options. You'll hear us talk about the people that can help you along this process, but we want you to just, the basics. And this is going to be important whether you're shopping through the Health Connector or wherever you're shopping. But there is a monthly premium that's associated with your coverage, and that's what you are required to pay each month. You can almost think about that as a membership fee. Now, when you enroll in a plan, there are going to be a set of covered benefits, and these essentially are all of the services that are covered by the plan. Now, you will have out-of-pocket costs. So if you are picking up a prescription or you're going to see a physician, there may be, in a lot of instances, a cost associated with that prescription. The carrier will cover a certain amount, but you as the consumer will pay the rest. Or when you go to see a doctor or a specialist, you could have a copay. And then you want to, when you're shopping for coverage, you want to get a better sense of what that health plan's network is. And the network really is going to be the thing that helps you potentially save money. So if there is a particular set of doctors, a particular hospital that you definitely need to go to or you want to have in your network, you may choose to go with a higher cost plan. If you are younger, you're relatively healthy, you may say, you know what, the network is not so important to me. I just want to make sure that I've got really good covered benefits. And you may choose, you may go in a different direction. So how do you figure this all out? So whether you're newly applying or you're an existing member, we have a website, a webpage dedicated to this, and my colleague Melissa is going to go through this, and this is our renewal page. We have lots of great information there and links to all of our tools. I want to describe the tools a little bit because I want to give Melissa time to demo these tools. But if you want to see what plans are available in your area and get estimates of what your savings could be, you can use our Get an Estimate tool. That's available from our homepage in the upper kind of middle of the screen, but on the menu bar, you just click on Get an Estimate, and you would select individuals and families and go through that process. So you do not need to complete an application to use that. Now, if you want to compare and contrast maybe what physicians or hospitals or health centers are available through a specific plan, you can use our plan comparison tool. And you can use this, and again, you do not need to be in your application. This is something that is outside of, it's on our website. Anybody can go in and use it. Now, if you want to get the most accurate view into what plans are available to you, what they're going to cost, whether or not your physician, your favorite doctor you've had for 10 plus years, you want to keep them, you are going to see that when you're in your own application and you use our Plan Finder tool. It works very similar, almost exactly to the way plan comparison works. So for today's purposes, Melissa's going to show you the external tool, the plan comparison tool, and you'll see how easy it is to get through that. Now, after you have used those tools, you know what you've decided on, enrollment isn't complete until the payment has been received and processed. So remember those deadlines I was talking about. If you are looking for coverage to start on January 1, you're going to need to go through these steps and pay for that coverage if you owe a premium by December 23rd. Now, if you're an existing member, and actually if you start shopping now and you choose, we will send your bill during the first week of December. Now, you don't need to wait for that bill. When you are in the online application, you can go through the process. You're going to see exactly what you owe, and then we'll talk to you about payment options. Now, very important, if you are an existing member and you're with Health Plan X right now, but you've decided to shop a little bit, you want to be a little bit more, you're a little bit more cost conscious. You want to be save a few dollars next year if possible. Things are going well. You don't think you're going to be in need of you're not going to be in as much need of healthcare services, what you're anticipating. You can shop, but you need to shop by November 23rd in order for the bill that you get in December to reflect all those changes. Now, not to worry, if you get your bill in December and you're surprised and you're like, okay, this isn't what I was expecting, and I don't want to stay enrolled in this plan next year, I don't want to pay this monthly premium, you still have time to review and update your application and shop for a lower cost plan. Again, you still need to do all of that by December 23rd. Now, how do I make my payment? How do you make your payment? You can do this online through our payment center. We take checking and savings account. We do not take credit card. You can pay by mail if you'd like. And you now have the ability to pay over the phone if you want to pay. Again, you just need to have all that information ready and available. The image to the right, just a sample of what a bill will look like. And you can also choose paperless, so you don't need to get the paper bill every month.
Can I chime in real quick, Nikki? I'm so sorry.
Oh, no need to apologize. Please, please.
I just want to mention on here too that we also have the option of auto pay.
Fantastic. Thank you so much.
Yes, so you can choose either the 15th or the 23rd to have an automatic arrangement so that it's deducted from your checking or savings account. So it's very helpful as well.
Okay, perfect. I totally forgot about that. That is such a great thing to remind people so that you can set it and it will pay and you don't have to worry about it.
Yes. Thank you.
No, thank you. Melissa, anytime, jump in. So getting help and resources, we've talked a little bit about this, but I just want to make sure we're very clear. There's free help available through our customer service as well as through assisters. Now you might be thinking, okay, who is this? Who are these assisters? What is that all about? But there are different community organizations that have partnered with us, and they're here to help as well. Now, one thing I like to mention, which I didn't mention hadn't mentioned yet, is if you are someone who has started the application and maybe has gotten stuck, you weren't able to get to the end, you don't need to worry. Whether you are calling customer service or connecting with local support, once you give that person permission, they can actually pick up in your application wherever you've left off, and they can help you get across the finish line. So our number for customer service is displaying. It's 877-623-6765. And we also have support available for people who are deaf, hard of hearing, etc. All of our information about hours, phone numbers, etc., are all available from our website. And when you're on our homepage, it's under the Help Center tab on the menu bar. And then also during open enrollment, we are also involved in putting on a number of community events. So if you're interested and you want to see if there's something coming up in your community, you can also find that on our website.
Can I mention one more thing on that as well? Sorry.
Yes.
Yeah. So
Melissa, we can't see you though. For some reason, we're not able to see you. If you want to,
there sorry. You are. There I go.
Okay, there you are.
I just wanted to mention that we also have a language line. So we have many languages. So please, if you feel that you need to speak in a specific language, we can also provide that option as well.
Okay, great. Now don't go anywhere because I think you're gonna, all right, stay with us.
Okay.
So community partners, these are the trained and certified assisters. So some people are known as navigators, others are known as certified application counselors. So as Melissa was talking about the language line, the language lines are available through customer service, but if you are working with like a local navigator or a local certified application counselor, they tend to speak the languages that are spoken in their community. So if you come to our website, there is a place where you can find local help, and you can see, I know our navigator information is updated and our certified application counselor information is being updated. So we're starting to add languages there too. But you can see if someone is available to speak to you either in person or over the phone, etc., in a language you'd prefer. For these folks, we definitely suggest you call ahead and make an appointment for help. But again, their help is here and the help is free. Okay, before I go to questions, I'm going to pass this over. I feel like we have a ton of questions, but I want to give Melissa a chance to actually demo the tools so you can see how all of this can work for you.
Awesome. Thank you so much, Nikki.
No, thanks, Melissa.
Sure. I'm just going to share my screen here. Just give me 1 second. And hopefully you can see that okay.
Yes, I can see perfectly.
Okay, perfect. Okay, so this is my favorite part because this is a way that you can make sure you're making an informed decision on a plan and what's best for you and your family. So what I'm going to do first is I'm going to go over the Get an Estimate tool. So if you hover right above the Get an Estimate, you'll get two options, and you want to click on individuals and families. So I'm just going to click on that. So this tool is basically a way that you can get a little bit of information without going through the whole entire application. So here we have the Get an Estimate and see if you qualify for savings on your monthly health insurance premium through the Health Connector. So if I scroll down, I want to pick the present year, 2023, and then I'm just going to enter a zip code here. And then it says, enter what you think your household income will be for the year. And I'm just going to make up a figure here. And then the number of people in the household, including people who may not need coverage. So I'm just going to say it's a couple, so 2. And then it's asking here the age of head of household. So I'm going to say 33. And then beside this here, you have a few options. So you want to click that this person needs coverage. So I'm going to leave that check here. And then here it says this person is pregnant or this person is disabled or blind. And the reason for these questions is because these determine eligibility as well. So I'm going to put the second person, 35. I'm just going to say this person needs coverage, and then I'm going to go to my results. So this is just a reminder that this isn't an application for health coverage. It's just basically an overview of what you may be eligible for. So I'm going to continue. And then here we have the estimated eligibility. So based on what you told us, your household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium costs. Your maximum tax credit amount is $487. You are eligible for silver plans with monthly premium as low as $261.88. So those are huge savings. So basically, if you think about it, the advanced premium tax credit of $487 goes towards your monthly premium costs every month, saving you money. So here we also have the household member. So it lists each member and then the potential eligibility. So both of these people qualify for a Health Connector plan with advanced premium tax credit. So that's great. So now we want to go ahead and preview the plans that they're eligible for. So this actually breaks it down much further. So the estimated savings details. So it tells you the household FPL, which is 300.38%. And then again, it shows you the monthly advanced premium tax credit for the tax household. Again, it's $487 that you're saving every month going towards your monthly premium cost. So then we further have a breakdown. What's listed here is the carrier, the plan name, the coverage level, the monthly premium, and then the monthly premium minus the advanced premium tax credit savings and what you would pay monthly. So if you scroll down, you have all these options available to you in your area, and it shows you exactly what you would be saving. So this is an awesome tool if you want to see if it's even worthwhile to go ahead and do the application. So once you determine that, yes, this is great, you're saving, your family will do great with these savings, you can go ahead and do the application. So what I'm going to do now, I'm going to go back to the renewal page and go over other tools that we have that are very helpful to our members. So this is, again, the renewal page. You see here that I did get an estimate, but now I want to scroll down. And then we have more options available to you. Here's what you need to do. So I'm just going to go over each one. The first one is to review your 2024 eligibility and plan. You will get a renewal packet mid-October to mid-November 2023. This packet tells you the type of coverage you'll qualify for in 2024. It also tells you the plan you'll be enrolled in unless you decide to change plans during open enrollment. You should review this information carefully. And now the second option we have is compare changes for 2024. Your premium for 2024 may be different than it was for 2023. For some members, you may need to update or confirm your 2024 income to make sure that your eligibility information is correct. You can compare any other changes to benefits and costs in your plans using the plan comparison tool. So Nikki went over this in her presentation, but I just want to remind everyone that if you have any changes with your income, you want to go into the application and you want to make those changes. It's very important that you do this because this does affect your eligibility. So now I'm going to go ahead and talk about the check providers and prescriptions tool. So this tool is awesome because you get to see which plans cover your preferred providers, such as doctors, facilities such as hospitals and community health centers, and prescription drugs that you want to use in 2024. So let me click on that. We know how important it is to continue to have your treatment with the doctor that you feel most comfortable with. So this is just a great opportunity just to make sure that it's covered by the plan that you select. So here it says, tell us about those who will be covered by your health insurance plan. So you just want to put in your zip code. And do you qualify for the ConnectorCare plan? And I'm just going to say yes. And what ConnectorCare plan type do you qualify for? And I'm just going to say plan type 2 and continue. So here you want to just enter the doctor that you're treating with because we're able to do a search on that specific doctor. So I'm just going to pick a doctor here, Dr. Dorr. And this doctor's in internal medicine, and I'm going to say continue. And I'm going to say that this doctor is from Brigham and Women's Hospital. Continue. And then I just want to also check and see if the prescriptions that I am currently taking is in network and provided by the plan that I would want to select. So I'm just going to put in this Ativan. So when you put this, you also want to make sure you put in the correct dosage form and strength. Those are very important. And then I will compare plans. So here we see that there are 3 plans available. We have the Mass General Brigham Health Plan, Tufts, and WellSense. So then you have your prescription drugs, your providers, and the facilities. So it shows you here in this breakdown whether or not your providers in network and whether or not the facilities in network and whether or not the prescription that you put in is in network with the plan. So for example, for the Mass General Brigham Health Plan, we see that the Ativan that I had put in for the prescription, it's not in the plan, but the provider is in the plan and the facility Brigham and Women's Hospital is in this plan. So if you say to yourself, you know, I want to continue with my doctor, I wanted to continue going to Brigham and Women's Hospital, you know, you don't see a prescription here, I think this would be, you know, one of the best options because both the provider and facility is in the plan. Then what I would probably do is pick this plan and speak to your doctor about the prescription. Maybe there's an adjustment that can be made, but if you wanted to continue again with the provider and the facility, this would be your best option here. So I think this is great that we have this here because now we can continue with the treatment that we've been having. So let me just go back to the renewal page. And I'm just going to go over the other options that we have available. So now you can compare health plans online by signing into your account to find the one that fits your budget and healthcare needs for 2024. So this is basically, I'm just going to click on it real quick and try to hurry up because I know we're almost approaching the end of this webinar, but I just want to show you real quick. So this would be the page that you would either apply for health coverage, or if you're a returning member, you would create an account. It's very important that if you already have an account to just sign into the account that you already have. You don't want to have any issues by duplicating accounts. If you have any questions, please reach out to one of our sisters or call the customer service number. So let me go back. And I believe it's the last one. Okay. I'm having trouble seeing it, but I think this is, let me click on it real quick. Okay, so these are just the ways that you can make your payments. It's very important that you understand that you can either pay online, you can pay by phone, pay in person, or pay by mail. So you can either sign into your account or you can make a guest payment. We take two forms of payment, checking or savings. We do not take credit or debit card or other methods such as PayPal. The deadline again is the 23rd, and we also have the auto pay arrangement, which you can make, which is the 15th or the 23rd of each month. If you would like that option better, you can also choose that as well. So now we come to the conclusion of our webinar, and we can take questions.
Yes. And folks, I know there are, we have so many people who joined today. So we will try, Neri, if you can try to give us maybe like, you decide, prioritize them. And then for questions that we weren't able to get to, when we send the follow-up email, we'll be sure to address those so you know where to find your answers. And so I will stop talking so you can ask us whatever you'd like.
All righty. Thank you, Nikki and Melissa. Yes, we have a ton of great questions in here. Certainly we will not have time to address them all, but we are seeing a lot of questions from individuals who are trying to submit a new application and they are not being allowed access because they have an existing application from years past. I know we discussed not creating duplicative accounts, but if you guys could just remind folks what to do in that case if you're stuck because you cannot access your application.
So I'll start, Melissa, jump in if you would want to give other advice, but I would say contact customer service and explain just that. So if you can't get beyond a certain place because you're not able to like retrieve your account, you don't remember your password, etc., call customer service. They can help you. They'll push a link out to the email that was associated with this account, and then you will be able to reset. And worst case, if you can't get in that way, they can go into the application with you and make the updates that you need to make.
Thank you, Nikki. And I think that advice goes for anyone who has also asked a question about very specific household questions or individual questions. Please reach out to customer service. Next question here that we have seen a lot in the Q&A is related to COBRA. So if you guys don't mind going through, you know, someone who's currently contributing to COBRA and wants to enroll in a Health Connector plan, how would they go about that process?
Okay, so as people may have found out when you are leaving a job and you're considering taking COBRA, sometimes a lot of times there's like a sticker shock because you're like, wow, okay, I can continue with this coverage, but I have to pay the full cost of this premium, and there's no employer contribution. So during open enrollment, this is the time, even if you were enrolled in COBRA through your former employment, you can shop for plans, compare plans, enroll in new coverage beginning on January 1. That is totally fine. You're not going to be blocked because we're in an open enrollment period. What I like to tell people is that if you have just recently lost a job and you're thinking about enrolling in COBRA and we're not in an open enrollment period, please come check out our plan options first to see if you can get any savings for you and your family.
Great, thank you, Nikki. All righty, moving on to the next topic here related to individuals who are over 65 or soon turning 65. And I'm going to try to combine this a little bit, but just talking about Medicare, whether or not they intend to go on Medicare, But yeah, any recommendations for individuals 65 or over?
Okay, so super important. People who are eligible for Medicare aren't eligible to enroll in coverage through the marketplace and get savings. However, there are going to be some people who are over 65 who aren't eligible for Medicare, or they need to pay the full cost. So what you are able, if somebody doesn't qualify for Medicare, let's say they didn't work enough, I'm going to say it incorrectly, I think it's units, but it's quarters, I believe. If you didn't work enough of those periods of time, you may be in a position where you want to shop for a commercial plan. That is allowed because you don't qualify for premium free, I believe it's Part A. Now, as you can see, our focus is on those who are under 65. If possible, what I'd like to do is ask if someone on our team can put in the chat a link to Shine. And if that's not possible, we'll provide you with all that information about Shine in the follow-up email. But basically, I'm going to put a plug in for some of our colleagues. Shine counselors are available all across the state, and they can help people who are Medicare eligible, 65 or older, etc. The other thing I'll say about 65 and older, and Melissa, please chime in too, because I know I'm like speed talking, but if you are 65 or older and you are in need of health insurance coverage, you may be in need of long-term care. There's all sorts of things you might want to consider and you want to look into. There is an over 65 application that you complete with our colleagues at Mass Health. That information you could find on mass.gov, and it's a lengthier process. It's a lengthier application, and it's not online yet. However, any Shine counselor would be able to give you guidance not only on Medicare, but also those options too.
Thank you, Nikki. And before I ask the next question, this is in regards to your demo, Melissa, which was super helpful. Thank you so much. But your example, I believe, showed coverage for 2023. Can individuals use this tool for coverage for plan year 2024?
Yes, you can.
Thank you.
Can I just add?
Nikki, do you want to add?
Yep. So if you look for plan year 2024, you're going to see those additional savings that we were talking about. So for Melissa showed 2023 because I know that there are some people who I saw very briefly said they need coverage now. So you can still enroll in coverage. You can still look for and apply for coverage that is going to begin on December 1st through us. And something we didn't mention is, of course, everybody is in a very unique situation. When you apply, if you have a qualifying life event, you could, again, qualifying life events let you get in outside of OE, but you may also find that you've used this application and you qualify for Mass Health. Mass Health's coverage starts immediately, and sometimes it will even go retro. So that's why we don't want to discourage anyone from applying at any time.
Thank you, Nikki. And then can you just briefly touch on employer-sponsored insurance? And if someone is eligible for that, can they also apply for a Health Connector plan?
So there are a set of requirements in order to be eligible for savings through the Health Connector. So if somebody is eligible for employer-sponsored insurance, that person should be looking to that coverage. Now, every person's situation is different, and you may be looking at the options that the employer is offering you and may think, this is not affordable for me, not affordable for my family. So what you can do is there is a worksheet on our site. You can take that worksheet, ask your employer to give you all of the plan information, etc. Because if you're going through our application, you can say, yes, I have access to ESI. And the application will help determine whether or not that, based on your household composition, that plan meets affordability standards for you. And Melissa, I feel like you're going to explain this in a much easier way, so I'm going to let you if you'd like.
I think you described it perfectly, Nikki. I can't think of anything else, but yes, there is a sheet that we would ask that you provide us with some information, and then based off of that information, we can move forward to see if you would be eligible for the Health Connector still.
And Nuri, I know we're a little past 1. I just wanted to see if others could stay on maybe for a few more moments. I don't know if we could stay on until like 1:05 or 1:10. I just want to find out from others. Would that be okay?
Works for me, yeah.
Okay, Kathy, is that okay? I think that's an okay. So yeah, because I want to try to help as many people as we can.
Yes, Nikki, we keep getting lots of great questions. If you guys could just touch again on the overall income requirements when submitting an application. I know, Melissa, again, you went through that demo, but just like household income and exactly what that means for folks who are struggling with this question regarding income.
Okay, yes, so household income is based off of, basically how I like to describe it to people is however you file your taxes, that's considered your household. So if you file jointly with your wife and you have dependents, that is considered your household. So that means you would have to basically put each one's income into the application, and that would determine the eligibility based off of that information. So if you're a couple and you have a child, you would actually put in the husband and wife's income, and then you would say that you do have a dependent, and then obviously if the dependent's not working or is too young, you would just say that they don't have income, and then based off of that entire information, we determine your eligibility. But again, if there's any questions regarding that, because I know it can be confusing sometimes, we are here to help you with that process.
Great, and I just want to add that when Melissa says we are here to help, we will be sharing specifically what we mean by that and the resources available to everyone in the community. Can either of you just briefly touch on dental coverage and whether or not that is included in a Health Connector plan?
Yes, so for dental coverage, we offer plans through Altus and Delta Dental. And if someone is interested, Melissa, I think I can help you navigate there. I know your screen is up. If you want to go to Learn, I believe, yep. Can you click on under plan information, the very last one, it says Learn about dental coverage?
Sure. Yeah.
Okay, so on this page, essentially you can, you're getting a description about dental plans. If you are using the online application and you want to enroll in health and dental, you can do all of that online. But let's say you are just interested in enrolling in dental coverage, or for those of you who are over 65 who want to enroll in dental coverage, you can just call customer service, and customer service can help you enroll into that plan. So we have plans for children. We also have plans for adults. They are organized. If you go down, I feel like we show how they're organized into, keep going a little further. There we go. There is I don't want to do our dental plans a miss-service, but essentially there are like levels of coverage that you're able to enroll into. And then if you want to look at all the benefits that are available, there are, if you go scroll up just a smidge,
yeah,
you'll be able to open up the there is essentially flyers here, but it's okay. We'll send this link to people so they can they can open this up. I think the most important thing is you can enroll online when you enroll in the health coverage, or you can just enroll in health and dental coverage. And those who are 65 and older can also just enroll in dental coverage if they want that, just by calling customer service. Thanks, Melissa, for keeping your screen up.
Sure.
Thank you. Nikki, and I think that we can do one more. I'm seeing some questions regarding our colleagues at MassHealth, our partner agency. I think we do want to share with folks that we are doing webinars with MassHealth on redeterminations, renewals, as well as I do see some questions in the chat regarding that process. Nikki, but I'll give you the floor if you want to put in a plug for that.
Yeah, absolutely. So we are working really closely with our partners at MassHealth. MassHealth is a separate agency, separate organization from the Health Connector. But as MassHealth is going through the full renewal process, we know that a good number of folks who are no longer eligible, or who will no longer be eligible for MassHealth benefits, could be eligible for Health Connector coverage and get access to savings, particularly as Melissa and I were describing for plan year 2024, because the income limit has increased due to the ConnectorCare pilot expansion. More people are going to qualify for that ConnectorCare program that we talked about. So please, just like if you were a new member applying or an existing Health Connector member, please go to your application and update your income, update all of that information about you and your household. And I'm going to ask Melissa to show one more thing because she's on the website. If you scroll all the way to the top, yep. Thank you so much. Yeah. If you click on Help Center, and can you click on Contact Customer Service?
Sure.
Great. Okay, so the phone number for customer service is displaying, as well as our TTY number. And then hours of operation, 8 a.m. to 6 p.m. And then we've got some information here about our walk-in centers. And then Melissa, Nuri, is it okay if we just show them where to find local help? And then I promise we'll end. I want to be respectful of people's time.
Yeah, of course. Go for it.
Okay, so Melissa, if you want to stop right there. For people who are MassHealth members, I feel like we might have captured some MassHealth members here today. If you are trying to just update that, and you're not even sure maybe if you're going to stay on and be a MassHealth member, don't worry about it. They can help you. There is a phone number you can call. You can you can actually use the scheduling tool to make an appointment. So all this information is also on our website. And very, very, very last minute, can you go back to the health center? And I think it says find local help under there somewhere.
Sure.
So,
where were we?
On one more up where it says help center.
Yep.
And find local help.
Okay. Oh, there we go.
Perfect. So if you want to just scroll down and great. It says individuals and families. There are like 226 places you can go and get help, small businesses, a bunch of places. But Melissa, where it says select category, could you choose navigators?
Sure. Yeah.
Okay, great. So there are 46 locations for navigators. They're sprinkled all across Massachusetts. And I think you might have to hit search or else it won't let you, but I can't tell because there it goes. I'm struggling at like you too. Like we can't see our whole screen. So yeah. I think, most folks have experienced Zoom before, so they know. Okay, so you can see all these different navigators, and you can also see, you know, where they're located, their own websites, as well as the languages that staff there speak. So again, we can't thank you enough for joining us today. I know it's 1:10. So again, I want to be respectful of everyone's time, and
yeah. And we also want to remind folks, Nikki and Melissa, that materials and the recording will be distributed after this presentation. So for those who are asking and might not have caught all the information, that'll be available to you soon. All righty. Well, thank you, Nikki. Thank you, Melissa. And thank you all for joining our webinar today. From everyone at the Health Connector and our sisters across Massachusetts, as well as our partner agencies. We wish you all well and thank you for joining.
thank you.
Thank you.